It's literally like comparing a whey protein to anabolic steroids.
Tonight we have Lujuan Meyer here. Lujuan is a medical doctor with a special interest in aesthetic medicine. Lujuan, you started a aesthetic practice about a year or so ago. Welcome.
Thank you very much, Francois. It's nice to be here with you guys.
Yeah, can you tell us how you got involved in that and what was it a passion of you to always study medicine?
First of all, medicine, my father's a doctor. So since I was a small boy, always thought I was going to do medicine. And after completing my studies, while I was busy with my internship and community service, I was actually thinking of doing ophthalmology, like becoming a specialist in eyes or plastic surgery. And then in my community service, which is basically the last of the 3 years we have to do for the government, I just found a significant interest in aesthetic medicine. And then I signed up for my first workshop, and straight after that decided, well, this is what I want to do.
Okay, and Lujuan, can you tell us more what entails aesthetic medicine?
So aesthetic medicine, people very often confuse it with plastic surgery because it's a similar line of work. Both disciplines try to slow down or reverse the signs of aging and essentially just make you look better. But in plastic surgery, it's surgery, so we're using scalpels, we're actually cutting something. Aesthetic medicine, we do almost everything with needles. So that is basically your treatments like botulinum toxin, dermal fillers, thread lifting, and so forth. So same line of work, but there's a small difference. But aesthetic medicine, to try and summarize it for you, is basically procedures that try to make people look better and slow down or try to reverse the signs of aging, essentially.
Can you refer patients to a plastic surgeon?
Yes, of course. Most doctors who do aesthetic medicine have a plastic surgeon that we work with, and some things we can fix with a syringe and a needle, aesthetic medicine, but many times the problem is something that is going to need surgery. So yes, in that case, we definitely refer to plastic surgeons.
What are some of the products that you have in your practice that you use?
Okay, so the products, most doctors who do aesthetic medicine, I think the most common treatment by far is going to be botulinum toxin that we use to basically, well, I can't say wipe out, but reduce wrinkles, especially wrinkles that you make when you're moving muscles. We'll get a bit to that later. And then I also do dermal fillers. Dermal fillers, like a gel, I usually tell people you can think of dermal fillers as what silicone is for breasts in terms of implants. Dermal fillers are for your face. So it's literally like a gel that is going to add volume or support or structure. So with fillers, we're literally changing the structure of the face. And then I also do thread lifting. Threads are basically dissolvable sutures. Now you get different types. You get small threads that do not have any hooks or barbs or cocks. We just insert them under the skin. The idea there is that the thread is going to stimulate collagen. So it's basically good for skin quality. It's almost like a rejuvenation effect. And then you get threads with hooks, and those we use to pull tissue in a certain direction. So we can do basically like a non-surgical facelift. And you can do a brow lift. You can do non-surgical rhinoplasties, which is basically we can alter the shape of the nose and so forth. And then I also do a few other things like skin boosters, mesotherapy, and so forth. We'll get to all of those a bit later.
Yes. Okay. John, you said something now about the signs of aging. That's quite interesting for me because when you look at someone, or if you just met someone, when you speak to the person, if I met someone at work or wherever, in your subconscious, you're like, okay, you guess the person's age, somewhere around 35 or 45 or 55. So what, according to you, what's the signs of aging?
Okay, so that's a very good question. The reason I think this question is important is because it explains why we do these treatments. When I started doing aesthetic medicine, at some point it just hit me. I was like, when you're looking at someone, you automatically within a second you estimate this person is 30 something or in the early 20s or 50 something. So what are the signs? What are you seeing that is telling your subconscious mind this patient or this person is X years old? So basically what it comes down to, the first thing is skin quality. So with skin quality, we're referring to wrinkles on the face. Obviously, the older you get, the more wrinkles you have. Then also, as you get older, your skin loses elasticity. It becomes very saggy, and people usually get um, areas of hyperpigmentation and some acne scarring. So that is basically just skin quality. And the second thing that happens is you lose volume, and you lose that in two different areas. So the first one, if you look at the skull, literally as you age, your skull gets smaller. You get bone resorption, and you get more in certain areas than in others. So your skull changes structure, you literally lose volume, and then your whole face is full of fat pads. And as you get older, the fat pads atrophy, which basically mean also they get smaller. So I usually try and explain it to patients with the example of someone who weighs 110 kilograms, who wears a double XL shirt. If that person loses 20 kilograms, that shirt is going to be saggy and full of wrinkles because there's no support underneath. So as you get older, you get bone resorption, you get the volume loss from the fat pads that lose volume, and then everything starts sagging down. Gravity starts doing what it does best and pulls everything down. So usually when I see patients who are basically 40 plus, everyone complains of exactly the same things. It's nasolabial folds, marionette lines, and jowls, these bulldogs that you get here on the side. And all of those are a result of your skin loses its elasticity. It's not as firm anymore. Plus you have the volume loss. So yeah, those are basically the main components that give you a subconscious idea of how old is this person.
We're going to speak about genes and your products in a bit. Do you think genes play a role in the signs of aging as well?
Yes, absolutely. So when it comes to aging, if any person, if you look at your parents, you're going to get an idea of how fast you're going to age and also the specific signs of aging that you're going to get. Some people in their genetics, they will just get a deep nasolabial fold sooner than others. Other people, when it comes to wrinkle formation, the process just happens so much faster than in others. So yes, it's definitely a genetic factor, but there's also a lot of things that we can control. So with aging skincare, literally the number one thing is going to be avoid sun damage, especially people with a light skin. So it's very cliche to hear, especially therapists like dermatologists speaking about using a sunscreen, having a skincare routine, but actually using a sunscreen can have a significant effect on delaying the process of aging when it comes to skin quality, wrinkle formation, hyperpigmentation, etc.
Quick one. What did you have to do training wise or education wise to get into this industry that you are in now?
So in South Africa, doctors and dentists are allowed to do aesthetic medical procedures, no one else. So if you think of specialities in medicine, people who do surgery go and specialize surgery, and people who do doctors who do hip replacements and the surgery when you break a leg or something, they go specialize in orthopedic surgery. So with aesthetics, you do not have to do anything afterwards. You're a doctor, you have a bachelor's in medicine and in surgery, so you can do the procedures. But it's not a matter of deciding I'm going to do this and just start injecting people. It's a completely different craft with its own possible complications, and you need to know your anatomy well. And obviously with the procedures, it's something that someone needs to teach you and you need to practice. So basically all the doctors that I personally know that do aesthetic medicine went for a fair amount of workshops and training and so forth. So basically, to summarize the question, doctors and dentists can do it as soon as they finish with their degree, but you're going to have to do additional training. Otherwise, you will probably you should be too scared to do the procedures, and if you aren't scared, well, your risk of getting severe complications is way too high. So most people that I know have gone for lots of additional training.
So on that, is there some of the procedures that's more dangerous than others?
Yeah, yes, definitely. If you think of something like with botulinum toxin, so obviously you can get an allergic reaction, but the odds of that happening is negligible. It's the chances is very, very, very small. So with botulinum toxin, the things that can go wrong is basically asymmetry in the face. Botulinum toxin paralyzes muscles. That's how we reduce wrinkle formation. But obviously, if you inject it in the wrong place, or if the toxin just moves to the wrong muscle, then you can get things like an eyelidsosis, where your eyelid's going to be hanging for usually it doesn't last long. It's going to be for a few weeks. Or if you over inject the forehead, which is the only muscle that elevates the eyebrows, you can get a brow ptosis, which essentially means your eyebrows will be, the position of the eyebrows will drop. So with botulinum toxin, complications aren't very common, and even if they do occur, it's usually not severe, and it's only going to last a few weeks or a month or two. Then when you get to something like dermal fillers, once again, if you are with a doctor who knows what they're doing, your odds of getting complications are small. But dermal fillers, if you inject it into a blood vessel, is going to occlude the blood vessel. Anything that does not get blood doesn't get oxygen, so theoretically the tissue is going to die. So that is a very big problem if that ever does happen. So yes, the treatments, some of them have, the incidence of side effects differ from botulinum toxin, fillers, threads, etc. And the severity of the complications also differ. But that shouldn't scare people away from aesthetic procedures. Basically, what it comes down to is the person who is treating you needs to know the anatomy. They need to know where the dangerous blood vessels are, what the depth of injection should be, when we should be using a needle versus a cannula. And most importantly, the question is the person treating you, if a complication does occur, can they treat it? Can they handle it? So to give you an example with dermal fillers, if you get a vascular occlusion where the dermal filler is injected into a blood vessel, we have something called hyaluronidase. So just some background on fillers. The main component of dermal fillers that we use is hyaluronic acid. That is a substance that is produced naturally in your body. Because it's produced naturally, your body also breaks it down on its own by an enzyme called hyaluronidase. So now we make dermal fillers, which is a synthetic hyaluronic acid, but we also have synthetic hyaluronidase. So dermal fillers the ones we use, can always be dissolved. It's actually quite cool. If you inject hyaluronidase on hyaluronic acid, it melts faster than a cube of ice if you pour boiling water onto it. It literally melts in front of your eyes. So if you were to get something like a vascular occlusion, you need to dissolve that filler immediately. So aesthetic medical procedures, it's a procedure. Obviously, there are complications. But if your injector knows what they're doing, the risk of having the complication is small. And the most important thing is, if a complication does arise, can the person treating you fix the problem? Can they handle the complication? And also when it comes to complications, I see this a lot in GP practice, where people ask me if I give them any sort of tablet, then they ask, well, does it have side effects? And then I tell them, if you go and look at the pamphlet of a Panado, the list of possible side effects is extremely long. As most people regard a Panado as something that would be very side effect friendly. So it's about the probability of getting the side effects. I knew when I drove here tonight, there's a chance that I'm going to die in a car. I still decided to drive because the odds are extremely low. So it's not about what can happen. It's about what can happen, how severe is it, and what's the probability of this complication happening. But like I said, with aesthetic medical procedures, the most important thing is the person who is treating you needs to be able to manage the complication if it does happen.
Speaking about side effects now, what's the stigma about being scared about aesthetic medicine or going to doctors or get fillers? Because I think personally, you see all these programs on TV that's the worst cases, and you see someone in the mall and with weird lips or something that doesn't look right. So now you judge that one person, but then you involve the whole industry. But there's 99 people that's walking past you that also went for aesthetic medicine, but you don't even see that. They just look good. Do you think that's the truth, or?
No, 100%. Look, aesthetic medicine evolved significantly over the past 2-3 decades, and I can honestly say the things that we can do with the products that are available are incredible. If you do the right procedure on the right person, the results will be positive. You can make a positive change the vast majority of times. But yes, as you said, there is still a big stigma around aesthetic medical procedures. I th- I think a big reason for that is basically what you're saying. First of all, we have these television shows like Botched, which basically display the worst case scenarios, these ridiculous things that happened. And then also in this industry worldwide and even in South Africa, obviously you get doctors who do not know when to say no, and you get patients who just want more and more and more, who kind of lose perspective of what looks natural and well aesthetically pleasing. So we do have a lot of people walking around with overfilled lips and too much filler injected into their cheeks and so on. But exactly what you said, I always tell that to people. You only see the fraction of people who went through a procedure where the procedure was overdone in such a manner that it looks unnatural. Everyone who went for lip fillers or had their jawline sculpted, or someone who's a bit older with volume loss who had some cheek filler, if it was done in moderation, right procedure on the right patient, then it doesn't look abnormal, so you won't notice it. So there's the television, this propaganda component, and the other thing is when you walk around, you only see everything that was overdone. And then people start thinking, well, if you go for lip fillers, my lips are going to look like this, which is not true at all. But unfortunately, yeah, there is still, it's gotten much better. But yes, there is still a stigma around many aesthetic procedures.
So do you feel that it's something that people can get addicted to?
Well, it depends on the what we decide the definition of addiction is. But yes, there are definitely people who can't get enough and don't know when to stop. So theoretically, yes. The majority of times I found if patients want something done and you tell them no, but you explain to them thoroughly why you say no, the vast majority of times at the end they will agree. So yeah, it's just a matter of, once again, like I said, the injector needs to know when to say no, but also you need to explain to this person why are you saying no, like why you don't want to do more.
And then people watching this, what age would you recommend people start booking sessions with you, or at least start considering aesthetic procedures?
So most of the products we use are approved from the age of 18 years old, but that doesn't mean you should start doing them when you're 18 years old. So the first thing that people usually do is botulinum toxin, and some injectors tell people you should start in your mid-20s because that is when most people start forming wrinkles. But I usually tell people it differs. It differs a lot from one person to the next, and it differs a lot from ethnic groups as well. Lighter people with a lighter skin color, people with a lighter skin color definitely start getting wrinkles much sooner than people with a Fitzpatrick 456 skin color. So it's not just a matter of age, it differs from one person to the next. Your ethnicity plays a big role. So with botulinum toxin, I usually tell people when you start seeing static lines, like static wrinkles, like when you move your fork, if you pull up your eyebrows and you see the wrinkles, that is a dynamic wrinkle. That happens when you move a muscle. From doing that repetitively, you're going to get static wrinkles, which means you're going to keep a straight face and there's going to be lines on your forehead. When you see those emerging, that is a good time to start botulinum toxin. For some people, that's going to be at age 22. For other people, it's going to be at 35. The majority of people, mid to late 20s, yes, but there's a spectrum. So I prefer to individualize And so, yeah, I prefer to individualize. So when you start seeing static wrinkles, good idea to start botulinum toxin. If you're unsure, just come in for a consultation, and any experienced injector will be able to tell you when you should probably start with botulinum toxin if you want to do it, as a preventative measure.
Yeah, that's my next question. So it is a preventative measure.
Yes.
So do you book sessions in advance?
No. Okay. One thing that people understand wrong about botulinum toxin is most people think it's something that older people should do. So botulinum toxin weakens muscles. So it takes away wrinkles that you would have formed when you contract the muscle. But once you keep a straight face and the wrinkles are present, botulinum toxin alone is not going to fix it. So lots of people think botulinum toxin is for older people, but by the time you've got static lines, I need to use skin boosters and dermal fillers as an adjunct to botulinum toxin to improve the wrinkles. It's not necessarily even going to take it away. If you start injecting botulinum toxin before you get static wrinkles, yes, then it's preventative. So botulinum toxin is definitely something that people should ideally start doing at a younger age.
When someone makes an appointment with you and you see them, will they tell you, this is what I want? Or do you speak with them and then you give them your opinion? Or say no, maybe in some cases?
I would say about 50% of the time people book and say they want to come and do botulinum toxin or they want to do lip fillers. And the other half of the time people just come, they just make an appointment and they say this line or this sagging over here, or yeah. So even people who book for a specific procedure, very often we end up doing something different after the initial consultation. So, but lots of patients are very clued up. They know the industry, they know the treatments, or if someone has been for treatments before, they basically know what they want and what they need. They're actually correct with regards to what they need. So many times they book for something and we end up doing exactly that. Sometimes they book for procedure A and we end up doing something completely different. And lots of people just make an appointment saying, "Help me, this is bothering me. What can we do?"
So how long ahead should people book? And then on top of that, does any medical insurance cover any of these procedures?
Yeah. Okay. So medical aid, no. The procedures we do are for aesthetic purposes. So the vast majority of times, no, your medical aid is not going to cover for it. There are some instances where where something that is a cosmetic problem overlaps with something that is also a medical problem. So in some rare instances, you can try to motivate for it and the medical aid might pay, but literally 99% of the times, no, it's not, the medical aid is not going to cover for it because it's not something that you need. It's like your medical aid is not going to pay for your facial or having your nails done because it's not a medical condition. There's nothing physically wrong. It's something that you want to do. And with regards to booking the procedures, so out of a preventative perspective, if you want to do botulinum toxin to prevent wrinkles, it's not a matter of deciding I'm going to do this now. I book every this many months or whatever. I usually tell people, so botulinum toxin for most people will last 3 to 4 months. Some people are lucky and they get up to 6. And I've seen people where the botulinum toxin literally works out in 6 to 8 weeks. So it differs from person to person. So I usually tell people, you do it the first time, you see how long does mine last. And then if you see it lasts 4 months, then you can decide, okay, I want to go full out with regards to preventing wrinkles. I want this stuff to be active all the time. Then you're going to decide, okay, I'm going to do it 3 times a year. But also, if someone's budget only allows them to do it once or twice a year, that's the other thing. Lots of people ask, yeah, but what if I start doing this and I stop? So nothing is going to happen. It's just the botulinum toxin is paralyzing a muscle. As soon as it works out, the muscle contraction will just return to normal. So if you do it just once a year and your toxin lasts for months, then essentially for a third of that year, you decreased the progression of wrinkle formation. So you don't have to do it the whole time. if you want to do it for the best preventative effect, then you do it once, you see how long it lasts, and then you decide how many times per annum are you going to do it. But if someone can only do it once or twice a year, that's okay. Then for a big part of the year, you're going to have less wrinkle formation, and for another part of the year, the wrinkles will worsen. But it's still going to be better than not doing it at all.
Yes. And what's the aftercare after the procedure?
Depends which procedure you're asking about. So the majority of procedures, very little aftercare. There's very little. Oh, okay, no, there is aftercare, but there's very little downtime. If I inject you botulinum toxin, there's going to be some areas of erythema. It's going to be red, but that's just going to last for 30 to 60 minutes. And the majority of times we don't have any swelling or bruising. So you can literally do that and in an hour go back to work, and it's going to be difficult for someone to notice.
The lip fillers as well?
No, okay, so lips. Okay, so with regards to aftercare, there's always instructions with botulinum toxin for the following 6 hours. Be very gentle when you touch the areas, because obviously we don't want to put pressure on the muscle and move the botulinum toxin to a different muscle. And you want to avoid things like lying flat within 4 to 6 hours after the procedure. And we tell people to avoid alcohol and no gymming, no sauna. So that's with botulinum toxin.
For the first 6 hours?
For the first 4 to 6 hours, yes. With fillers, now you have completely different aftercare instructions with regards to what I'm going to ask you to do. But the downtime, like I said, with botulinum toxin, it's barely any downtime. With fillers, it's not downtime in the sense that I need to book you off, you need to stay at home. But lips have a significant amount of blood vessels. So lip fillers, the majority of times, you're going to have a reasonable amount of swelling plus minus bruising. So I usually tell people, don't book lip fillers 4 days before you have to attend a wedding or something, because some people will be lucky and have minimal swelling, no bruising, but other people, you're going to have, your lips can bruise significantly and it can stay there for many days. So it differs a lot from one procedure to the next.
Yeah. Were there patients before who came for lip fillers and they will give you a call and say, maybe my lips look better on day 2 when it was a bit more swollen than after 4 or 5 days? And then they will come back for more fillers?
Yeah, so that's actually funny. It's a joke I make with patients. I usually tell them just before the procedure, I tell them, if you stand up and you look in the mirror, don't be frightened, because up to 40% of what you're going to be seeing just now is swelling. Because obviously, if you're poking a lip with a needle multiple times, you are going to have some swelling and bruising. But then I usually also tell them, and then I tell them the swelling will go down over the course of the next 10 to 14 days. And then I tell them, most people come back and they tell me, I liked how my lips looked on day 2. So it's literally, that's all. It's the majority of times that is the case. It's a joke, but it's because usually people are happy with the volume afterwards, but I think it's just that little bit of extra 10-15% extra volume that they have when there is still some swelling. People usually come back and say they wanted that. But with lip filler specifically, I go slow. I'm very modest with the volume that I use in the first procedure, because I usually tell people we can always add more in 2 weeks. But once we put it in, to get it, like if it's too much, I'm going to have to dissolve the filler, which is another procedure where we're going to have to inject your lips. Plus, it's a second product which you can get an allergic reaction to. So always rather move slow. We can always add more. We don't want to overdo something and have to reverse it.
So these aesthetic procedures, are they mostly focused on the face, or are there other parts of the body that you can target as well?
The majority of body treatments. Okay, so obviously in plastic surgery, body treatments, you can basically make any part of the body look better cosmetically. With aesthetic medicine, yes, there is quite a few things we do. Myself at the moment, I'm basically doing face. neck and the neck, let's say, like the upper part of the chest area. That's also an area where we can do a lot of improvement on the skin quality. And then I also recently started doing biostimulators, which we usually use for the face, but you can use that to do a non-surgical buttock lift. That's just a procedure. When I heard about it, it made a lot of sense to me. And then I went for the training and I was like, okay, well, this is cool. And the results that I've seen people get with this is quite stunning. So at the moment, I'm doing that.
It feels like there's a stigma that aesthetic procedures are more focused on females. Is that true, or are there also procedures for men that they can look at?
Yeah, so the majority of the market is women. Um, but the reason for that is obvious. Women are obviously much more interested and focused on beauty and aesthetics and looking well than most men. So yes, women make up the biggest part of our clientele, but there is a significant amount of things we can do for men as well. Theoretically, botulinum toxin for women is going to prevent wrinkles. For men, it's going to do the same thing. Dermal fillers, we can use it in men literally just in the same manner that we're going to use in women. We're just going to be treating different areas. So this is where femininity and masculinity come in. So with a woman, you want an upside down triangle in the face. You want a sharp chin. You want, this shape going up towards the cheeks where you have lots of volume. In men, it's the opposite. You want, a normal triangle. You want lots of volume in the lower part of the face. You want a broad bigonial diameter, square jawline, strong chin. So with dermal fillers, as many things we can do for women, we can do for men. It's just we're going to focus on different things and treat different areas. But yes, there's literally all aesthetic procedures are for men as well. Men just aren't that interested in aesthetic procedures as women are. And that is the reasons, therefore, are obvious. It's how it's always been. Women are more into skincare and beauty and just looking after themselves.
About 15 years ago, yeah, a lot about aesthetic medicine. Correct me if I'm wrong now, but lately it's not everywhere, but the industry has exploded. Do you think social media plays a role, or why did the industry become like this now? It is, and the future of the industry as well.
People realize that there's many things that we can do that is actually going to improve someone's appearance without making them look fake. Then the second thing is people are living longer. So 200 years back, no one really cared what they looked like at age 45, 50, because everyone was old. And that was just the norm. Now, with people living longer, people care much more what they look like into their 30s, 40s, 50s. So I think that's another reason why the demand increased. And the third one is, without a doubt, social media or just technology in general. So a few hundred years back, it was difficult just to find a mirror. Now, with cell phones, it's just everyone is just taking pictures, and you've got social media, and you're doing video calls and meetings on Zoom. So you're confronted with, what do I look like, so much more than people were a few centuries ago. So now a small thing on your face that really wouldn't bother you that much, well, you're looking at it the whole day, it's bothering, so it's going to start bothering you more. So I think that's another reason. So definitely social media, but the fact that people live longer, and the fact that society started realizing that everything we do in aesthetic medicine does not have to look like it's done. It doesn't have to look fake. So I think it's a combination of those three factors.
What's some of your goals that you would like to achieve in the industry in the next few years?
So aesthetic medicine is a daunting industry to go into when you start. If you compare it to everything else in medicine, if you go and specialize, for instance, you become part of a department and you're going to work there for 5 years. And especially in the beginning, when you're still unsure about what you're doing, you're going to have someone there who's helping you and guiding you and teaching you. Well, this is different. This, people go for a course on botulinum toxin and fillers, and then the next week you've got someone in your chair and you're going to inject something and you just petrified, like, I'm a word, I can't screw up this person's face. So
There's no one there with you.
There's no one there with you. No, it's a daunting industry to go into initially. So for me, a big milestone. Well, I've come a very long way from since I started 2 years back. I've had to attend a certain. I've done a 2 year advanced diploma in aesthetic medicine, and besides that, I've attended numerous workshops and training sessions, and I've come a very long way from there. But I still have a long way to go when it comes to perfecting certain procedures and start treating new areas and so on. So for me at the moment, I'm literally just focused on, well, one, building a brand, but secondly, just building experience and the skill set. So yeah.
Is there a procedure that stands out to you that you really enjoy or that's really interesting to you?
Okay, so the procedures that I enjoy doing the most is going to be dermal fillers, whether that be for lips or for cheeks, chin, jawline, doesn't matter. The thing with fillers is fillers look like a gel. So when you inject it, it adds volume and the results are immediate. So fillers, you inject someone, you give them the mirror afterwards, and it's boom, the result is evident immediately. So fillers are fun because the patient satisfaction that comes with it is usually it's high and it's instant. I love doing lips. I do lots of lips, and yeah, just fillers in general, I would say, is my favorite procedure.
You speak about this on and off camera. You're very passionate about it. So is it a passion for you to help people?
So as aesthetic medicine, yes, I love this industry. When I first stumbled across it, I was like, okay, well, this is awesome. This is for me. As I mentioned earlier, the other things that I would have considered in medicine would be plastic surgery and ophthalmology. Now, what those two and aesthetic medicine have in common is all three disciplines require very fine, precise, detailed work. So aesthetic medicine, well, first of all, it's a very happy environment. Really, it's not, you don't have patients dying and being sick and having pain and so, and constantly. So it's a very happy environment. And second of all, that part of me that is slightly artistic and likes precise work, I can basically use that in aesthetic medicine.
Are any of these procedures painful? Because I think if someone's watching this and you say you stick a needle in their lips, that sounds painful. But do you numb the skin, or
So okay,
are people afraid of the pain during the procedure?
So, okay, yes, most people are concerned about the pain that they might experience beforehand. But to be honest, look, we're working with needles. So obviously, I can't tell you that you're going to feel nothing, because if I'm going to inject something into the skin or underneath the skin with a needle, obviously, well, it's going to cause pain to some degree. But some of the procedures, like botulinum toxin, for instance, the needle that we use is extremely small, and the areas we usually treat aren't that sensitive. So when I ask patients afterwards to describe the pain on a scale from 1 to 10, most people say 1 or 2 with botulinum toxin. So that's really not painful. So we don't use a numbing cream. Then for other procedures, like if you're going to be doing lip fillers or botulinum toxin for underarms for excessive sweating, that is painful. So then we use a very strong numbing cream. We leave it on for a sufficient period of time, and that makes the procedure very, very bearable. Honestly, most patients, when we're done, tell me that really wasn't bad at all. But it's a matter of some procedures aren't painful, so then we don't have to do any form of anesthesia. And if we're treating something that we know is going to be painful, we use sufficient amounts of anesthesia. Obviously, we want to make it as comfortable for patients as possible, because if the procedure is excruciating, well, no one's going to come back.
What are some of the most prevalent areas in the face that you treat with botulinum toxin?
So with botulinum toxin, three main areas that we treat in the upper face. So it's the frown, forehead, and crow's feet. These horizontal lines that form next to the eye when you're smiling. So that is the areas we treat most with botulinum toxin, and that is also probably the most common aesthetic procedure in the world by far. With botulinum toxin, you can also treat other areas. Many of them are off-label, but you can treat the depressor anguli oris, the muscle that pulls down the corners of the mouth if you want to lift the mouth corners. You can use them for people who have bruxism, which is essentially jaw clenching. Lots of people get prescribed like plates that they need to use for their teeth by the dentist. It's the masseter muscle. It's the muscle that you use to bite and chew. If that muscle is overactive, it causes the grinding, and that can cause headaches, pain in the jaw area. It's horrible for your teeth. So in that case, we can inject the muscle with botulinum toxin to weaken the muscle, and that is going to help with the jaw clenching, with the pain, and etc. So there's many things we can. There's really many areas we can treat, but the main treatment areas is frown forward and crow's feet with botulinum toxin now.
What are some of the, I would almost say, the questions that you get the most from patients that come to you?
What I'm getting a lot of at the moment is I get a lot of younger people who want to come and do botulinum toxin as a preventative measure. And I also do lots of lips, also younger patients. But the question or complaint that I get most often is older people literally all complain about the same things. It's the nasolabial fold, the marionette line jowls. Everyone comes in and they sit on the chair and they complain about the exact same thing. And the reason therefore is what I explained earlier, is the volume loss that you get with the bone resorption and the fat pads that get smaller and your skin quality that worsens and you lose elasticity and so on. So that would by far be the most common complaint or question that I get is, what can we do about these? And the answer is usually mid-face filler. It's incredible what happens if you. That's the thing with cheek filler. When we're doing cheek filler, we're not necessarily trying to enlarge the cheek, so add volume. We're just trying to replace the volume that was lost when we're doing cheek filler. So most people who are over the age of 40 will benefit a lot from literally just mid-face, which is cheek filler, because it's replacing the volume that you had 10, 15 years ago, but that since disappeared, and now you're sitting with all of this sagging tissue.
And those patients prevented it.
So volume loss to some degree is inevitable. With botulinum toxin, you can, to a great degree, prevent wrinkle formation, but volume loss is going to happen. So at some point, you're going to need either biostimulators or dermal fillers to help with the sagging tissue and replace the volume. But as a general rule of thumb, the sooner you start, the easier it is to prevent the sagging and aging and to maintain what you have at the moment.
Can you quickly explain a bit more what a biostimulator is, what you can do for the skin to help it keep its elasticity and stuff like that?
Okay, so biostimulators are basically, so one of the biostimulators that we use frequently is made of polyl lactic acid, which is a very similar material to what we use in dissolvable sutures. Now, biostimulator that contains PLLA is essentially the same material that's been chopped up into millions of small pieces. Then we mix it in a solution with sterile water and lidocaine, and then we inject that into specific areas in the face. So that solution is very different from dermal fillers. It's not that we're injecting something that is going to artificially add volume. The water in that solution is going to get absorbed, it's going to disappear, and all that will be left is these PLLA molecules. And what they do is they draw fibroblasts to the area. Fibroblasts are the cells that produce collagen. So it increases the it basically makes your body produce its own collagen at a significant rate. So that collagen is going to do three things. One, it's going to improve the skin quality a lot. Second, it's going to add some degree of volume in the areas that we inject because of all of this collagen being built. And thirdly, the collagen is going to make the skin firm. So it's literally going to pull the tissue in the direction where the product was injected. So with biostimulators, we usually injected higher up and lateral. So if you get the collagen production, it's going to pull the tissue up and back, which is essentially what we're doing when we're doing when someone goes for a surgical facelift. So biostimulators are for people who don't want to get fillers and threads. It's a very cool alternative treatment because it's natural in the sense that it relies on your body's own collagen production. But also, I can't say it's not a substitute for dermal fillers and threads. Usually, these things work best if used in combination.
We see a lot of ads about products, face cream with, and you said something about, I think it's hyaluronic acid, and you said something about collagen now as well. As everybody know, you can buy collagen and you can throw it into your coffee or whatever, and you can drink it. So what's the difference drinking collagen and using the products that they advertise and
Injecting a biostimulator.
Yes.
Obviously, if you compare hyaluronic acid in cream versus skin boosters or dermal fillers, which is hyaluronic acid that we inject, or if you compare liquid collagen that you drink versus injecting a biostimulator, it's literally like comparing a whey protein to anabolic steroids. It's the same. It's going to do the same thing, but obviously, if we inject it, you're going to get a much, much higher concentration of that product under the skin tissue. So I usually tell people, if you're going to inject a biostimulator for collagen production, you might just as well be drinking collagen as well, because it's going to help just top up and boost the effect that you want to get from the biostimulator. But it's not as effective as the injectables. It's the same with hyaluronic acid. If we inject a skin booster, then you might just as well use a hyaluronic acid cream as well to kind of, just top up the injectable procedure that we did. But obviously, if you compare a cream or something that you ingest versus an injectable, obviously whatever we're injecting is going to be stronger.
Yes. And Lujuan, do you have any future? Do you want to do any extra procedures in the future?
Well, yes, definitely. As I said earlier, I've come a very long way with regards to experience and getting comfortable with procedures, and I'm doing most of the things that I want to be doing at the end. But there are still some procedures that, obviously, when you start in aesthetic medicine, most people, you start with botulinum toxin, you start with cheek and chin fillers, because those are procedures that they're commonly requested, and also it's safer procedures to do. You leave the more difficult, daunting stuff for last. So I've come a long way, but yes, there are still some procedures that I decided not to do yet. Wanted to get more experience with, well, I wouldn't say basic, but with the first batch of procedures first, and then going to move on to that.
Where do you see the industry going in the next few years, and do you see it continuing to grow as it has?
Definitely. I think it has grown significantly with regards to innovation and popularity. And with both of those, I think it's just going to keep on moving up. With every generation, people live longer, and the impact and importance of technology and photography just keeps getting more and more and more. Those two things drive people's need for, well, aesthetic procedures, because they want to look better and they want to look young for longer. So yes, I think from here on forward, it's going to follow the same trend.
How do people reach you that are considering any procedures or that's thinking of doing a consultation with you?
So I've got an Instagram page. The handle is just at DRL Aesthetics. And on there, so I've recently opened a branch, or not a branch, but I collaborated with a salon in Johannesburg. So I'm going there on a monthly basis to do procedures. And the rest of the time, I'm in Bloemfontein full time. So on my Instagram page, you will find the numbers for bookings in Bloemfontein or in Johannesburg. Or if you just want to ask me a question with regards to a specific procedure or specific area of your face that is bothering, then you can find everything on Instagram. Also, I had we're currently building a website. I think it should be live in before the end of August. Should have a website as well. So then theoretically, if anyone just Googles Dr. Lujuan Aesthetics, you'll find the website with the contact details for appointments.
Cool.
Okay, awesome. Lujuan?
Then, final one, also asking for a friend. Have you done or would you ever do any penis enlargements?
No, no. So
Who's the friend, I'm sure.
You.
I haven't done any. It is a procedure that people do with dermal fillers. But no, I haven't done any, and I do not think I'm going to be doing that anytime soon. Maybe sometime in the future, but very, very, very far into the future. For now, I don't have an interest in doing penile enlargement. Thank you for asking.
I'll keep that in mind. Thanks.
Lujuan, thank you for your time.
Thank you very much. Thank you
Thanks
guys.
for being here.
And we are excited with you, and we support you in your journey.
Thank you very much.